About 2 weeks ago, my cell phone rang, and I answered it, and it was from the White House, it was from the Department of Health and Human Services staffer asking me to attend a summit on mental health and illness and homeless and addiction in America. And so that summit was this past Thursday, 2 days ago, and I was at that event. And it was attended by two of the cabinet secretaries, Secretary Azar of the Health and Human Services and Secretary Carson of Housing and Urban Development, along with Assistant Deputy Attorney General and others. I will be writing a blog that will come out this Thursday, which will detail all the attendees who were there, the significant people. And it was really focused on trying to resolve and solve this problem of the seriously mentally ill, those with addictions, and the homeless in America. Brief history: in the 1960s and 70s, prior to the 60s, the standard to get somebody in a facility, mental health facility, for psychiatric treatment prior to the 1960s was they needed help. If you had a family member psychotic, disorganized, unfocused, couldn't care for themselves, before the 1960s, you could take them to a mental health facility and get them admitted for treatment. In the 1960s and 70s, that shifted, and the standard in America, and you guys probably know this our whole life that we've grown up since those of us born in the 60s, has been a danger to themselves or others. If they're not a danger to themselves or others, even though they're psychotic, disorganized, can't focus, delusional, if they're not dangerous, you can't get them into a hospital. And so right now in America, there are 4 million people living on the street who have serious mental health problems. Or more than that if you count the addiction problems. The Trump administration is very serious about changing this dynamic and going back to a system in which families can take their loved ones to a facility and get help, even if they're not a danger to themselves or others, if they are seriously mentally ill or addicted. Amen. And then they want to create facilities, and Dr. Carson pointed out that you can't provide housing alone to people like this because that doesn't work. It doesn't get them well. You can't provide mental health treatment alone without housing. That doesn't work. Amen. And so they want to create integrated programs in which they're like these clubhouses in which you can take these individuals, put them in a healthy home environment in which you have mental health professionals that can provide their treatment or recovery, and then they work with local communities and businesses to, as they recover themselves and organize themselves, they are then transitioned into a work environment in some place where they can be productive. This is what they're trying to do. Dr. Carson pointed out that in the Trump administration, homelessness, with their policies they've been able to put in place, working with state and local governments, has gone down in every state except California. Because California's laws don't allow the Trump policies to be put in place. So California has increasing homelessness going on. They are still working and discussing with the officials of California how they can implement these policies, but the policies are right now obstacles, and that's part of the problem. Anyway, so we were there three and a half hours into the meeting. Suddenly, things began to change. These staffers, the room suddenly fills up with all these photographers, cameras, the news affiliates, the staffers. All the aisles are just jammed full of people. And then on the stage, they come remove all the chairs from the people, and they bring out this podium and they hang the president's seal. They put the president's flag out, and then they introduced Donald Trump, and he came in. And I was on the front row, so I was from here. I was to my mother. That's how close. And I took some photos and video, and he came basically because he wanted to emphasize his administration's commitment to really making meaningful change, and to thank us who are working in the mental health field for what we're doing, and to tell us that he would love our input and any suggestions that we can bring to bear that can make meaningful change. I was able to, I don't know if you guys know, Could It Be This Simple, the book that I wrote in 2007, has been translated into 8 other languages. And then Susan and Rich Collenberg and I developed the Could It Be This Simple, The Way Out of Your Prison workbook. which is specifically designed for inmates and prisoners to help them identify healthy decision-making, overcome the impulse control issues, put into place God's principles. And this is approved in the California prison system by their prison board. It's being used at Folsom Prison and multiple state prisons around the nation. And testimonials come back about reduced violence and reduced recidivism for those who participate in the course. And at Folsom, there's a 6-month waiting period from the inmates to get into the program that use this book. And so I was able to give a copy of this with a cover letter to the Assistant Attorney General to hopefully they'll look at this and see if this is something that can be integrated into the program. The Trump administration had people there in attendance from law enforcement, from state legislatures, from the American Psychiatric Association, as well as people who value the spiritual aspects of the human being to bring spiritual principles to bear in healing. They're really holistic and integrated in the approach. So I was very humbled and privileged to be part of that process, and we'll see how it goes from here and how things develop. So you can keep in prayer, this process of how we can work to provide programs to help the most disenfranchised, the most vulnerable in our communities, and help lift them up.